Good morning. Bonjour mes collègues et mes amis. Je vous remercie pour votre présence ce matin. We are here today for a momentous occasion. My name is Rajesh Aggarwal, and it's my great pleasure and honor to welcome you all here today to the Simnovate International Summit, hosted by the Steinberg Center for Simulation and Interactive Learning, here at McGill University in the wonderful city of Montreal. So, why are we all here today? Well, healthcare is complex. It took 50 years from 1900 to 1950 for medical knowledge to double. In 1980, it took 7 years, and in 2010, it took about 3.5 years. In 2020, it is projected that medical knowledge will double every 73 days. Right now, in 2016, there are over 70,000 different diagnostic codes for medical diseases and almost as many different procedure codes for their treatment. Just last year, the FDA approved 1 new drug every week. There's a growing elderly population, and therefore a greater number of age-related ailments requiring care. The health impacts of more people living with chronic disease and obesity has already begun to overwhelm health systems around the world. We're also living with huge disparities in health outcomes. For example, the life expectancy of a girl born in Sierra Leone is half as long, 42 years, compared to a girl born in Japan, 86 years. And the chance of a child dying before age 5 in Angola is 90 times higher than in Finland. Healthcare delivery is also evolving, from being focused to the management of acute episodes to the coordination of care for chronic and relapsing diseases. It's now team-based, patient-focused, and available in multiple settings. Beyond traditional hospitals and clinics, medical care can be delivered in the home, in a shopping mall, and even in mobile trucks. With this immense complexity, with multiple practitioners, with many healthcare settings, there is a risk of harm. The figures vary, though about 1 in 10 patients admitted to hospital experience a medical error. A recent report from the National Academy of Medicine says that most of us will likely experience a diagnostic error in our lifetime. Improving diagnosis requires teamwork, good communication among the entire healthcare team, with patients as central members of this team. Concurrent to this transformation of healthcare is an equivalent, if not greater, emergence of interactive and technology-enhanced learning platforms. The technological education revolution can also bring together learners from all over the globe, sharing best practices and engaging across cultural and societal contexts. The internet, smartphones, mobile apps, virtual reality simulation, serious gaming, immersive environments are all advances in our strive to do better for our patients. Even more so, 3D printers, artificial intelligence, wearable technologies, the Internet of Things, and smart machines bring further opportunities for healthcare innovation and disruption. The convergence of multiple sectors of technology and industry is evidence of the era of limitless possibility. Simnovate is a mission, a community, and a partnership of passionate, driven, and game-changing individuals who wish to see the change we can make together in the world right now, bringing together simulation, innovation, and education for better health and care. We began this process almost 1 year ago, on May the 25th, 2015, in the then-named Arnold and Bleemer Steinberg Medical Simulation Center. 4 domains were identified: patient safety, medical technologies, global health, and pervasive learning. Each of these 4 areas have been led by our amazing co-chairs, Robin Tamblyn and myself for patient safety, Benoit Galix and Carla Pugh for medical technologies, Madhu Pai and Jishnu Das for global health, Olivier Dienz and Marlies Schijven for pervasive learning. Thank you to you all for your commitment. You're going to hear extensively from them and the domain groups throughout the next 2 days. Our 4 domain groups comprise 48 world-class experts who are innovative, eclectic, and enjoyable to engage with. They hail from 35 different institutions across 9 different countries from 4 continents. From these, a remarkable 34 of our experts have traveled across the globe to make it here today, and I thank you all. Breaking traditional silos and boundaries, our domain group experts span healthcare simulation, outcomes research, aviation, serious gaming, patient safety, economics, machine learning, biorobotics, implementation science, and the list goes on. The work you will see presented today from each of our 4 domain groups is also a testament to the grit and engagement of our 4 domain research fellows, Phil Puka, Amin Madani, Lekha Puri, and Wayne Choi. Thank you to all of you too. Also, I'd like to take a moment to thank Arnold and Blima Steinberg for their generosity, vision, and encouragement, for all they've done to drive forward this mission at McGill and beyond. Arnold was a very special person. He's dearly missed. So, what a treat we have for you over the next couple of days. The Simnovate International Summit includes 3 keynotes from Victor Zhao, David Ash, and Kedar Mate, 8 workshops, 4 pitches for seed money with 2 of our toughest sharks that we could find, a youth innovation panel, a debate, which the speakers assure me will be good-natured, and a roundtable discussion. You'll have the opportunity to engage in dance therapy, design thinking, lean healthcare, and policy analysis. So I urge you all during this 2-day event to leave your day jobs behind, to immerse yourselves in the diversity and freshness of this event, to think out aloud, to share your craziest ideas with the person sitting next to you, to consider the impact of simulation, innovation, and education on our mind-blowingly complex and diverse healthcare systems, and to do this together, to be bold, to challenge convention, consider new ideas and opportunities. As was stated by Leonosuke Satoru, a 19th century Japanese poet, let your dreams outgrow the shoes of your expectations. So let's begin that process here today. Let's drive forward the Simnovate mission, working and engaging together. Or in the words of another well-known African proverb, if you want to go fast, go alone. If you want to go far, go together. Mm-hmm. Thank you very much for being here. I really appreciate it. I'm so excited about the next 2 days. And now I'd like to ask Dr. David Eidelman, Dean of the Faculty of Medicine here at McGill University, to say a few words.
Thank you very much, Raj. That was a very inspiring opening. Bonjour et bienvenue à tous. It's really great to be able to welcome you here on behalf of the Faculty of Medicine. Some of you will know that there's at least 3 other major events going on simultaneously. I seem to be giving one of these speeches at all of them. But this one's particularly special for a couple of reasons. First of all, I remember when Raj came to my office to propose this, and it seemed like such a cool idea. It's really great to see this transform from a cool idea into a real event, and it is really an exciting event. I want to thank all of you who've come from away, and of course those of you who are from here for participating. There's no question that, as Raj mentioned, Arnold Steinberg was a tremendous inspiration for this event, but also an inspiration for our faculty. I personally benefited greatly from his wisdom and his support. And along with his wife, Blima, his vision and generosity are absolutely pivotal to the creation and ongoing excellence of the Steinberg Center for Simulation and Interactive Learning. It's a fantastic place if you've never seen it. It's really a leading edge, a simulation center, and it's growing and becoming even better. But I see many of my colleagues in the room who've had the pleasure of actually teaching there or learning there and know really on an organic basis what a fantastic place the Simulation Center is and how central and pivotal it is to our faculty and all of our schools in terms of its role in bringing together people from across the different professions to work together in the way in which medicine is evolving for the 21st century, where medicine is much more interprofessional, much more about team-based work and learning and creating learning organizations in the healthcare system. And I think the Simulation Center here at McGill really epitomizes that and has been avant-garde in terms of its development of that approach. When you go to we recently had one of our many accreditation visits. This time I think it was the surgeons were in town, and it was great to see people from different professions around the table talking about how integral the Simulation Center was to their work. So I'm really very excited about this. I'm also excited that this is Simnovate, the word innovation. We're lucky to have Victor Zhao here who's going to talk about innovation in a moment. But really, this is something, many of you in the room have heard me talk about how McGill is sometimes, it's an old school and sometimes it's very old school. It's my hope that we're becoming a much more innovative, nimble, and exciting place. And I think this event really is a great example of that. And in terms of innovation and excitement, I have the privilege of working for an innovative and exciting boss, and it's now my honor to introduce her. So Professor Suzanne Fortier is Principal and Vice-Chancellor of McGill University. She's a native of the metropolis of Saint-Timothée, Quebec, which I'm sure you've all visited, and she can talk at length about. But she very unusually for a Quebecoise of her generation, she came to McGill and obtained a BSc in 1972 and then a PhD in crystallography in 1976 at a time when doing crystallography was hard. So she's very smart. Her research work focused on the development of mathematical and artificial intelligence methodologies for protein structure determination. And she made contributions as well to the development of novel techniques in crystallographic data mining to gain new insights from the large structural databases. Prior to her appointment as principal, a position she held from September 2013, she was president of NSERC, the National Sciences and Engineering Research Council of Canada, from 2006 to 2013. And she was vice principal academic from 2000 to 2005 at Queen's, as well as vice principal research there from 95 to 2000. And as well as she's been a professor in the Department of Chemistry, where she is here at McGill, as also in the School of Computing at Queen's. She's an outstanding academic, and we're very lucky to have her as principal, and it's my pleasure to introduce her.
Merci, David. Merci. Eh bien, bonjour et bienvenue à vous tous. Bienvenue à Montréal, à McGill, et bien sûr à Simnovate. My colleagues have already said a few words about the Steinberg Center for Simulation and Interactive Learning, and I want to add or repeat some of the things they've said because they're really, really important for us. The center, I think you will, you know, or you will hear in your stay here, is a real source of pride and inspiration for all of us at McGill. It came from the vision of a great man and a great family. It's always wonderful to have among your group of friends people who can see further and can bring you to see further. And that was certainly the case of Arnold and his whole family. And the vision was inspiring because it was one that recognized that if we bring learning, research, innovation together, we can do great things. We can have real impact on society. And that's exactly what they're doing. And I must say, because Arnold is not with us anymore, he was so proud of Raj and what he was doing. And if he were here, you would be blushing So I have to do my role here to make you blush a little bit, because they're doing a fantastic work in bringing that vision to a real reality. And in many ways, this is what Simnovate is about, is bringing people, ideas, so that the work you do has a real impact on society. And our keynote speaker this morning, who I have the real pleasure of introducing, is someone who fully, totally represents this vision. And we're all looking forward to his remarks, because we know that he will offer a very unique perspective of this vision from a very distinguished career experience that he brings to us.